Health officials are sounding the alarm about the rapid spread of RSV, a respiratory disease. It can be fatal if it's not treated, and now at least 33 states, that includes Illinois and Wisconsin, are reporting a big spike in cases, mostly among children who are under the age of 5.
Dr. Julie Holland is the Vice President for Pediatric Primary Care for the Chicagoland Children's Health Alliance and joins us now. Doctor, thanks for taking some time for us. First of all, tell us about what you've seen. Discuss the cases we've seen locally. How bad is it right now?
So it's pretty bad right now. RSV is a viral disease that causes airway inflammation and wheezing in young children. It's the younger you are and the more health conditions you have, the worse you are. Part of the reason we're having a big surge right now is because for the last couple of years, with kids being masked and everybody being very cautious about infection control, we haven't seen much RSV. So we have a lot of young kids who've never seen it before, and we're having a big surge right now, so a lot of them are getting sick.
Of course, we still have COVID out there. People have got colds and other things. How do you know what your kid has? What are the signs of RSV?
So RSV tends to cause wheezing and respiratory difficulties in young kids, much more so than a lot of other viruses. But the best way to find out is to get tested. Rhinoviruses, enteroviruses, RSV, COVID, they can all cause respiratory disease, runny nose, cough, fever, all those sorts of things. Most pediatricians' offices, most immediate cares, most hospitals can test pretty rapidly for all of those things and let you know what's going on.
So your advice is, if you're a little unsure, is it a cold? What is it exactly? And the kid has, or the child has those symptoms, maybe just get that test done and know for sure?
Unless your child has very mild symptoms. If your child has symptoms of a mild cold, they have a little runny nose or a low-grade fever or a little cough, but they're eating well and acting well, you don't necessarily need to have them seen. But if you have any concerns about your child's breathing or a high fever or anything like that, your pediatrician is usually a good place to start to have your child assessed. And obviously, if your child is exhibiting severe shortness of breath, that means a trip to the emergency room.
Are there certain kids you maybe need to have a closer eye out on, like maybe those with asthma or things like that?
Well, for RSV, it's the younger kids that are at highest risk, and the kids who have heart or lung conditions, those are the highest risk. But for all of these illnesses, certainly any child who has asthma or any other medical condition is going to be at a little higher risk. Again, for most of these illnesses, the courses are fairly mild in children, but there's a lot of kids who don't have mild cases, and those are the kids that we're seeing right now in the ERs, in the hospitals, and unfortunately some of them in the ICUs as well.
Great. Good information, Dr. Julie Holland. We appreciate your time. Thank you so much.